Hey, hey, hey there, woman. Hey, hey, hey there, girl. The time has come, there's work to be done. Come on, you women of the world. Hey, hey, hey there, sister. Hey, hey, hey there, friend. Come and walk by my side. Sing out with pride. Come on, you women of the world. They say that change is a coming. They say that change is good. You've got to change whatever you can in the place where you stand. Hey, hey, hey there, woman. Hey, hey, hey there, girl. The time has come, there's work to be done. Come on, you women of the world. Hey, hey, hey there, sister. Hey, hey, hey there, friend. Come and walk by my side. Sing out with pride. Come on, you women of the world. They say the road is so long. They say it's always been. No matter how deep the roots may be, you've still got to shake that tree. Hey, hey, hey there, woman. Hey, hey, hey there, girl. The time has come, there's work to be done. Come on, you women of the world. Hey, hey, hey there, sister. Hey, hey, hey there, friend. Come and walk by my side. Sing out with pride. Come on, you women of the world. Come on, you women of the world. Come on, you women of the world.
Hi there, you women of the world. Thank you for joining the Famous Five Foundation on this, a Famous Five Friday. It's a day when women have more power and see more opportunities. And exactly like Jeanette Arsenault sang to us, we women of the world, it's time for us to join together and talk about the issues that matter to us and make improvements in the world that matter to us. So thank you for chatting in the chat room. Please continue throughout the program. And when this virtual pink tea is over in about an hour, please join us for a question and answer with the two remarkable hosts, two remarkable panelists we have today. I know you will really enjoy meeting them and be inspired to help them and to help other girls and women live a better life. Well, we're in a time of change, as Jeanette Arsenault just sang, and we in Canada have heavy hearts because of the passing of our monarch, Queen Elizabeth the Great, some people are calling her. She was a spectacular role model for us, a constitutional expert, and someone who will be remembered and affectionately remembered for many, many years. My heart is also saddened by the passing of an amazing trailblazer and a nation builder, and that's Dr. Rosemary Spears, who died also last night. Rosemary helped organize the organization known as Equal Voice, which is throughout Canada, recruiting and teaching women how to be involved politically, and specifically how to be a candidate. She and her friends also established the program called Daughters of the Vote, where every 2 years, 338 spectacular young women go to Canada's House of Parliament, House of Commons, and sit in the seats and talk about the issues that are important to them today. But on the good side, or on the happy side, Britain has its third female prime minister. And just like the Queen, who actually called Canada her second home, Liz Truss, the new UK premier or prime minister, knows about Canada because she spent 1 year when she was 12 years old living in Burnaby because her father was teaching at Simon Fraser University. So Britain has had 3 female prime ministers. We've only had one, albeit a glorious one, in the Right Honorable Kim Campbell. But I'm sure Kim is saying, where's number 2? Where's number 3? Where's number 4? So hopefully after today, some of you will think, I'm ready to take the next step and be involved politically and become a Prime Minister of Canada. Or if not you, please search out that woman and support her and encourage her. As you know, our presenting sponsor for these virtual pink teas is a long-time sponsor of the Famous Five Foundation. For slightly more than 20 years, Enbridge has helped us in many ways to present a variety of programs. And for the virtual pink teas, they always provide one of their excellent female leaders. Today, we're going to meet Samantha Fox. Samantha is a senior asset performance advisor. And she has earned an engineer. She's an engineer and also earned her MBA. And it's quite appropriate that Samantha be the Enbridge representative today because she is a mother of 1 and in a month's time about to become a mother of 2. So we're very grateful for Samantha fitting in this introduction of our panelists and a brief message from Enbridge as part of this virtual pink tea. So Samantha, good luck with your next project, your next big project, and please introduce our very, very fine speakers. Thank you. Merci. Miigwech.
Thank you, Frances. I'm honored to be here today on behalf of Enbridge. Enbridge exists to help fuel the quality of life within the communities where we live, work, and operate. Every day, we energize communities through the volunteerism and the generosity of our employees. Through investments and partnerships, we collaborate with community leaders and organizations like the Famous Five Foundation. We help build capacity, support programs that are inclusive, future thinking, and bring out the best in people. Enbridge is also committed to building a diverse and inclusive workforce. We want to empower and encourage our employees to model inclusive behaviors. We want to work together to promote awareness and respect for one another. We recognize that a diverse and inclusive team will be more innovative and agile due to broader perspectives, skills, and capabilities. This allows us to deliver better outcomes. With that, it's my pleasure to provide an introduction to 2 very remarkable women who demonstrate these values. As you know, our VIP guest speaker today, Dr. Rupinder Toor, established the IUD Women's Clinic approximately 15 years ago. Not content just to help her patients on a one-by-one visit basis, Dr. Toor started reflecting on the cumulative reasons for the visits and decided to analyze her records and carefully consider the comments from her patients. As a result, she realized the extra important impact that long-acting birth control was making not only to women and girls' physical health, but also to their mental health and their lives in general. Dr. Toor's sensitivity to cultural matters has also distinguished her service. As a result of her outstanding leadership, she has been awarded the Queen Elizabeth II Diamond Jubilee Medal, the Global TV Calgary Women of Vision Award, the Outstanding Service Award from the India-Canada Association of Calgary, and an Immigrant of Distinction Award for Entrepreneurship and Innovation. Secondly, I'd like to introduce medical ethicist Juliet Guichon, our VP host. This impressive academic is also a remarkable author and community leader. Some of her achievements include persuading many of the Catholic school boards in Alberta to allow nurses to provide HPV vaccines to children on school grounds, thus preventing a variety of cancers. Next came her successful campaign to limit the availability and therefore use of vaping by youth. Last fall, Calgarians voted overwhelmingly to reintroduce fluoride into city water, thanks to the skillful and persistent leadership of Dr. Guichon. A number of provincial and national medical organizations have recognized her significant contributions, and recently she has received funding from the prestigious Canadian Institute of Health Research. These two are such an accomplished and dynamic duo. Like all of you, I'm happy to say, over to you, Dr. Guichon. Thanks for being here.
Thank you so much, Sam. What a wonderful and humbling introduction you've given to both of us. Welcome, Dr. Toor. It's a real honor for me personally to appear with you.
Yes,
So-
thank you for having me. I'm quite excited to be here today.
Well, thank you. I was reflecting on our conversation today, and I thought that perhaps the audience would really enjoy hearing about how you came from being a baby girl born in the Punjab in India to becoming not just a physician, but a physician who runs her own business in Northeast Calgary.
Yeah, it's a good story. So I was actually born in North India in a small rural hospital that I actually had the privilege of going to visit several years ago. And my aunt was a maternity nurse and had been present at my birth. And so she asked me to follow her into a room. And, she took me into this room that was looking onto this field. And she said, "This is the room that you were born in." And it obviously gave me lots of chills. And as I walked outside, there was different posters on the wall, and of course mostly in Punjabi, but there was one section that was in English and it said, "Save the girl child." And so I thought, my goodness, like here I was, a girl child that was born in this hospital. Who would have known my life trajectory would take me to Canada and I would get trained as a medical doctor and then be able to come back and visit this site. So that's where my story started. We immigrated to Canada when I was 4 years old. We went to Montreal. We had some family there, and then we moved to Calgary in the late 70s, and I've been here ever since. And I think I was always, I guess I didn't have a lot of sort of mentors, maybe people in my family that had gone to university. So I really had to self-navigate that situation. I really didn't know what I wanted to study. And when I was in high school, we were doing Bio 30, and that was all about the human body. And I thought, my goodness, what a fascinating system. Like, I would love to learn more about this. And started to look into careers, that could focus on that. So I started to look, well, I could become a paramedic or I could become a doctor. And so I thought, well, let's try for medicine. And so I did my undergraduate at the University of Calgary. I did my biochemistry degree there. And then I applied for medical schools, and I will share how naive I was when I entered medical school, because I just thought, okay, when I got in, I'm sitting there, it's the first few days of lecture. I'm like, okay, I'm going to be a doctor. And then I realized I have to decide what type of doctor to be. Right? I hadn't even contemplated that, because I was very inexperienced, very naive, raised by immigrant parents who really, didn't have the resources to guide me. And so luckily I got through. I trained in family medicine. And I think I was actually in medical school at the University of Calgary. We were learning about cervical cancer. So I, went and asked my mom. I said, "Mom, have you had your pap smear done?" And she said, "Yes, I have." And I said, "Okay, well, when?" And she said, "Well, I think it was when your brother was born." And my brother was a teenager at the time, and we were supposed to be going every year at that point. So I said, "Mom, like, you haven't been going for your pap smear. Why don't you go?" And she says, "Well, my doctor's a male doctor. I don't feel all that comfortable, receiving that kind of care from him." And then I said, "Well, aren't you worried you might get this cancer?" And she says, "Well, it's kismet, it's fate. If it happens, it happens." And so in her story, just these little few micro barriers that were stopping her from doing something as simple as a pap smear. And I started to ask my cousins and my aunts, and same thing, nobody is going for all of the same reasons. And so that's where that seed got planted, where I thought, maybe I could open up a clinic where women might feel comfortable coming. Maybe we could have doctors that were all female that maybe spoke different languages. Maybe then these women would feel comfortable coming in. And so I started the Northeast Women's Clinic back in 15 years ago, so 2007. And we were surprised because right from the very beginning, because we thought, immigrant women, maybe South Asian, that's where our language skill set was. But right from the onset, 50% of our patients were Canadian-born women. So that led me to believe that we all maybe have a preference of maybe going somewhere where we feel a little bit more comfortable when it comes to our sexual and reproductive health issues. And that desire just maybe becomes a little bit stronger, let's say for women from certain cultural backgrounds. So it has been a beautiful ride. Yeah.
Your story is really a remarkable story of a Canadian woman and really how great Canada is that it would welcome a girl child from the Punjab and promote and educate and watch as you contribute to the nation, really. So thank you for your overview of where you are now. And I might like to ask you more specifics about contraception, which is where you were getting at. Most people actually don't know, as far as I know, that contraception, which you provide routinely, used to be unlawful. It used to be unlawful for it to be prescribed, for it to be used, or for it even to be discussed. Why do you think it is that people just don't know that?
Yeah, I feel like, the story of contraception is a fascinating story, and one that's really, I think, under recognized and under celebrated, because really it has been the game changer for women all over the world. And I do start off, we were doing a lot of information sessions for our patients, and instead of just talking about the contraception, I would set it up as a framework first of, true or false, was contraception illegal in Canada? And people are really surprised to find out that answer is actually true. And what's even more surprising is when that law was changed, because it was in the Canadian Criminal Code, so it was punishable by 2 years in jail. That law did not change since 1969. So
it did
for
change
us,
in 1969.
yes, so that's when
Yes.
it changed, right? And so for us to even be having this Zoom talk today is something that, we've only been able to do in the last 50 years, which is
It wouldn't have
very,
been
very
lawful, which is
yeah, it would
extraordinary, isn't it?
be a very recent history. And in fact, the very first lecture in Canada at a medical school happened in 1967 at the University of Toronto. It was Dr. Doug Cannell. He was a gynecologist. And he started out the lecture by saying, "Ladies and gentlemen, today I'm giving you an illegal lecture. And if I go to jail, you are all coming with me."
History loves company. So tell us, what are the statistics regarding birth control use in Canada?
Yeah, so it's not so much that birth control isn't used, it's sort of what's being used, I think, is kind of maybe the bigger sort of issue. And so I started finding some trends when I was starting to do some work in the Northeast. So maybe a little bit more vulnerable populations. We had a lot of immigrant women. We had a lot of women that didn't have a lot of socioeconomic resources or supports. We saw a lot of young women. And I started to notice that, women, and there was one patient in particular, her name was Carla. She was a 13-year-old at the time when I started to see her. And, she had already been sexually active with a couple of partners. And I asked her, so what are you using for birth control? And she said, condoms sometimes. And I just looked at her and I thought, my gosh, you're going to be pregnant in a year. And if you get pregnant and have a baby when you're 14 years old, she was in the foster care system. I thought, this cycle is just going to keep repeating itself. And I could almost see it happening. And I kind of saw my role there, as a doctor, going beyond just, what do you need to just, serve you today, as far as, no, like, Carl, what are your goals for your life? What are your reproductive goals? What are your visions? My job isn't to tell you what you need. My job is to help you think about these goals, and then maybe link you up with science and innovation and technology that will be most likely to help you achieve some of those goals.
So you did something that's actually revolutionary in the experience of many women. You asked the woman what her reproductive goals were, and then you communicated that you would provide your expert advice so that she could achieve her goals. What do you think the effect of that question has been on women whom you've helped?
Yeah, you know what? Because I really was just motivated by, okay, I need to engage these girls and women in this conversation. Because when I asked Carla, she's using condoms. I said, well, how's that working? She's like, well, it's fine, and because it was fine because she hadn't gotten pregnant up to that point. And I thought, okay, I need to reframe this discussion in a certain way. And I realized I only needed to ask them 2 questions, right? So the first question is, when do you actually want to be pregnant? And the second question is, how important is it for you not to be pregnant until you're ready? And with that, I found I could get a really good idea of what their goals were. And I said, okay, well, if you really don't want to be pregnant until, let's say, you're in your 20s, and it's really important for you, here are some of the methods that will most likely help you meet that goal. And I was just looking at reproductive sort of goals. And, for a lot of these women, they were young, they were impressionable. And a really interesting thing happened because when I started asking some of these girls these questions, the first thing they actually responded with was with confusion, because it was like until they had been asked, they didn't even think it was their decision to make. So they were living, and this is what I have learned from my vulnerable patients, is that their life experience is often, life happens to me, I don't get to choose what happens to me. And pregnancy is something that happens to me, I don't get to choose when I get pregnant. And when I said to them, no, here's something that could, 99%, chance, I can give you assurance you will not get pregnant for the next 5 years, an interesting thing started to happen. I could tell these girls were starting to switch their thinking, and they were like, what? Like, I can do that? Like, I can decide when I want to get pregnant? And then you could see they would start to think about other things. And so then I thought, my goodness, this is not birth control. This is a tool of empowerment. And this can really spark this empowerment mindset in some of these girls that have this life experience, that life happens to me. So as soon as they can have the experience of, I've set up a goal, I went to a professional and got help and assistance in reaching that goal, and I achieved that goal. What is my next goal, right? And I know one of the most heartbreaking things a patient has ever said to me was, she was a young Aboriginal woman. She had sat with me for about 40 minutes and talked to me about her life experience and, how her experience had been being an Aboriginal woman, and how, people received her, and kind of the attention she got. And she said to me, she goes, girls like us, she goes, we don't dare to dream. But I saw how long-acting birth control could spark some of these dreams for these women.
Well, this is, it's remarkable you dared to dream about being a physician, and that dream has now allowed younger women to dream about having their own life too. And the means by which this is being achieved is long-acting birth control. Could you please tell us what long-acting birth control is?
Yeah, so I think I'm just going to use this opportunity just to share my screen here, just so you guys can see, because obviously some of this stuff will work a little bit better. So birth control here, you can see just a nice little visual or infographic here that's been developed, just looking at sort of different forms of birth control. So one of the things I tell my patients is you do have a lot of options, but you can see the options at the bottom there that, there's still a number of women that will get pregnant. The second tier, the green tier there, is things that are better. You can certainly see less pregnancies, but our gold stars of birth controls, the ones that are the most effective forms of contraception, would be in the top tier there. And that's what we call those long-acting forms of birth control. And so LARCs is what they're kind of used in medical terminology, and they have been endorsed by a lot of large bodies as really being our preferred method for contraception for women who really don't want to get pregnant. And so LARCs are basically long-acting reversible contraception, and there are 3 things in that category. So 2 of them are IUDs. IUDs stands for intrauterine device. They're small little devices that are designed to be placed right inside the uterus. And then in Canada now, since August of 2020, we also have what we call a subdermal implant, which is a little rod that gets placed underneath the skin. So what really defines a long-acting form of contraception is that you do something once, and it gives you birth control for an extended period of time, so at least a year or more. And because you don't have to do something every day or every time you have sex, they are over 99% effective. And one of the things people don't realize is that all birth control is not created equal. And so there is a big variance in the effectiveness amongst different models. So you can see we have two types of IUDs. We have the copper IUD, which has no medication at all. It just changes how sperm move. That's how it prevents pregnancy. Women will still have their regular periods, but they can be a little bit heavier and crampier. And that's about $80, and they can stay in place for 5 years or more. We also have medicated IUDs. So these ones have a little bit of progesterone that gets released locally inside the uterus. And what it does is it makes a plug, which blocks the sperm. That's how you get your birth control. The medicine also really thins out the blood lining. So periods tend to be much lighter and less crampier. So we usually say about an 80 to a 95% reduction in period flow and less cramps. These ones can cost a little bit more. They're about $400, but they can last for 5+ years. And there's a few different varieties in those ones. And then the subdermal implant is a small rod. It's about the size of a matchstick. It's placed underneath the skin in the arm. It releases progesterone into the bloodstream. It works a little bit more like a birth control pill, and it suppresses ovulation. And that can stay in place. It can be effective for at least 3 years or more. And it's about $270.
Right. So people who choose an IUD or the rod might like to know whether this form of birth control is reversible and how quickly they would return to fertility after the removal of the devices.
Yeah, so if you notice in that one infographic, they did use sterilization is also over 99%, so male and female, but those are permanent methods, and so not appropriate for a lot of younger women who may want to retain their fertility. So to be considered a LARC, so long-acting reversible, so that means it can be reversed. And the return to fertility is fairly quick. So there has been reports of ovulation within 7 days of sort of taking out, let's say, the subdermal implant. The copper IUD, the return to fertility is immediate because as soon as the copper is gone, the protection is gone. So return to fertility is immediate. And with the medicated IUD, again, women tend to still ovulate while they're using that because it's a localized action. It really just makes that plug. And so again, as soon as the IUD is out, if they're, that next ovulation cycle, they would be able to conceive. So it is a very quick return to fertility.
And how do you advise women to prevent STDs? Because of course, these are not barrier forms of protection. So how would you advise women to prevent sexually transmitted diseases such as HIV, HPV, chlamydia, and so on?
Yeah, so we do sort of like to separate the two out. We say, contraception is really important. That's pregnancy prevention. Use what is best for you for pregnancy prevention. But you may also want to take added measures to help protect yourself against infections that could be transferred through sexual activity. So strategies around that can be limiting sexual partners or using barriers like condoms as well with new partners until you're both tested.
Great. That must be very comforting for patients to know that you've anticipated their needs and taking very seriously what their goals are and helping them stay healthy until they decide, if they should decide that they'd like to have children. But the patient herself patients themselves actually have varying levels of motivation. What is the role of motivation in long-acting birth control that you find significant?
Yeah, I think that reproductive goal setting is really important because if we can get together behind a common vision, I feel like that's really the most important thing. So it really shouldn't be what I think is best for the patient. It's me really asking the question, what do they think is best for them? And saying, okay, well, based on what you're telling me, let's say if you don't want to be pregnant for at least a year or more, and it's really important for you not to be pregnant. Like a pregnancy would really be altering of your life path, and that's something you don't want to do right now. Here are the methods that will most likely sort of are best suited for those goals. So I feel like if we're both sort of behind the shared vision, I think that really makes a big difference.
And some women are, or girls and women might forget, for example, to take a birth control pill or forget to use a condom. And so motivation there is light or limited. And so that puts them at risk. What level of motivation is required for long-acting birth control?
One act of motivation. So one act. So you call your doctor, you do your consult, you go in, you get the procedure done, you have it placed. And then that one act of motivation can last you, like I said, 3 to up to 12 years, right? Depending on which form of contraception you choose.
So,
And the other thing I kind of like to say is, women of today are very different to women of the 1960s, when the birth control pill first came out. We know that contraception usage back then was, women would often, finish up high school, maybe get married, have a couple of children, and then their need for contraception was really for afterwards. Whereas now we know that, average age of first sexual activity is around 16 and a half in Canada, and average age of first baby is 30. So there's about 13 years of contraception that women need. And in that time frame, they're quite busy. They're going to school, they're developing their careers, and maybe they don't have that kind of routine and schedule to be able to remember to even do something every day at the same time, right? So it's, it's not something I think, we're just different beings than what we were, right, in the 1960s. So I feel like this, a lot of women say, I just want to do something and just forget about it. I don't want to have to deal with it. And so I have a nice little joke going with my patients. I say, okay, well, if you choose one of these long-acting forms of birth control, I can give you a 99% plus assurance that you won't get pregnant. So really, that fear of pregnancy, like every month to get my period or not, I'm going to do like that fear is going to be gone. Like you don't have to manage that anymore. It's out of your way. And if, for example, let's say you choose the medicated IUD, which I've said will really reduce your period 80 to 95%, which might mean you don't really have to deal with a period. And I said, you know what? This is what guys feel like. They walk around not worrying about pregnancy. They walk around not dealing with periods. I said, this thing is going to give you the freedom to be like a man. Like, you can just go and live your life, and you can focus on all of the other things that you deserve and you want to achieve in this life, right? Without having to have those two things hanging over you.
And pregnancy scares, do limit performance, because sometimes they're coincident with exams. People are stressed about their exams. They don't get their period. Then they think they might be pregnant. And so they don't do as well as on exams. And that, to have that whole concern be taken away, already addressed with long-acting birth control, does put women more on par with men in terms of exam performance.
And I'm realizing more and more we are feeling beings. It's our feelings that really motivate us. And so what I do is I exchange this feeling of fear and nervousness and apprehension to a feeling of empowerment and success and freedom and choices, right? That is really the work that I'm doing. And I think those feelings are so important. If I really want to support all women that I see to live their best life, and I do feel like everybody deserves a big and gorgeous life, and here's some tools that are going to help you reach those goals and help you reach that life, right? So regardless of, your background and your circumstances.
Well, that's wonderful. We have two students who are grateful to you for the work that you're doing and feel empowered by it. They're both from West Island College here in Calgary. And the first is Catherine, and she appreciates you raising these issues and is interested, though, in the economic aspect of the program. The question is, what might it cost to have a nationally funded long-acting birth control program?
Yes, so that's music to my ears, because that is one of my hopeful goals, one of my legacy projects, maybe before I exit, is to try and advocate for universal coverage for contraception for all women 25 and under in Canada. And the cost savings, I think, will be clear. The cost, just the system cost, like just for unplanned pregnancies in Canada, is about $320 million, right? So that's our cost that we're up against. And we know, let's say, even just a procedure of an abortion costs about $800 to the system. And a lot of these long-acting forms of contraception are $400 and less. So right there, it makes sense, right? Right there, we know that there is a cost savings. And there's costs that we can't capture, right? So what about the cost for a young teen who decides to carry on with his pregnancy, and now this is going to be subsidized by society? There's a huge cost there. And what is the cost of this untapped potential for this woman or this young girl who had all these dreams and maybe could have been, a really contributing member of society, but now has had these unplanned pregnancies that have taken away some of her attention and some of her, her goals and some of her dreams, and the things that she wanted to achieve. So I think the cost analysis, I think it is very straightforward that a universal program like that would cost us money, not only money, but heartache, and, just would save us all of those bad feelings of feeling discouraged or feeling like life is happening to you, feeling like you didn't do what you needed to do to get to where you wanted to be. So.
Right. Catherine's classmate, Corey, is interested in perhaps a more intimate question. She's interested in knowing whether parents must be involved in a decision of a person under the age of 18 who seeks birth control but doesn't want the parents to know that she's sexually active or contemplating sexual activity.
Mm-hmm. Well, the good thing is I've definitely seen a trend and a shift in that. So more often than not, when I see young girls coming in 13, 14 years old, they're often accompanied by their mothers or their parent. And when the dad comes in, I think that's even better, or the dad's driven them. So I do feel like there's been a shift towards more open conversations in families about, when to start sexual activity and how to do that and with whom. And I think that is a conversation best had in families, So for me, I'm really at the point whereas if you've decided that you want to start sexual activity, and you don't want pregnancy or you're concerned about infections, here's some resources and some guides that I can give you. And so when I see anyone under 18, definitely I'm bound by patient-doctor confidentiality. So as long as I feel like this patient can understand the risks and the benefits of either taking or not taking this treatment, then that's, we have sort of informed consent and I do not need to contact their family members. The only exception to that rule would be if there was a young person that I felt was having sex in a relationship that was exploitive, right? And that is by law, we are required to disclose that, right? So if I found out a 13-year-old was having sex with her teacher who's 25, that would be an issue and I would need to report that, right? So I do ask some questions, about, who are your partners, who, do you feel comfortable? How is this sexual activity feeling for you, right? And so, obviously those situations are rare, the concerning ones. So most girls are just, they're dating, they have partners, they're exploring their sexuality, and they're making one of the best decisions they can by coming to see me because they're being responsible about some of these choices and behaviors that they're doing. And they, they want to take those precautions to protect themselves and be safe for both them and their partners.
So given that there are no real legal barriers for a young person who wishes to access long-acting birth control, and you would recommend it as being desirable, given that it requires only one act of motivation, why don't more girls and women use long-acting birth control? Is cost the barrier, or is there something else?
I think it's probably multifactorial. So I think just awareness. I feel like there isn't really sort of a push for, really like 70% of the population is at risk of an unplanned pregnancy. So what that means is 70% of the population is in the reproductive age group and having sex, but not wanting pregnancy.
You said
so
70.
Yeah. So, between the ages of 15 and 45. And so to me, that's a public health issue. Like that really affects almost everybody. So, 7 out of 10 people, it's going to affect. And the repercussions are pretty significant. If we don't contracept and we have a pregnancy, that's a pretty significant outcome. And so, but I don't think we think of birth control that way. We think, oh, it's hush hush. We don't talk about it as society. So I think one is just lack of awareness. People just don't understand a lot about contraception and just the details about it. And then lack of access is always an issue. The long-acting forms of contraception often required some sort of a procedure. And so we sometimes need healthcare workers that are sort of trained in that. I'm just going to share my screen again, just because we were talking a little bit about this. And so this is just looking at, because the intrauterine systems were the ones that were more historically available in that LARC category, this is looking at sort of the uptake or utilization rates across Canada since 2014 to 2019. The dark red is sort of the Canadian average. So you can see there has been a steady incline there from, the usage at 7.3%, and then rising up to 10%. So, so we are making some headways here. But I want you to look at Alberta, because we started at 7% and we are peaking at 14%. And so when we kind of compare those numbers globally, we're actually one of the global leaders as far as utilization of long-acting forms of contraception. And it's because I think we've done a really good job. I think, stories like Carla's have really inspired a lot of healthcare providers in our region to really be proactive about this and to really address that awareness and that access issue. And I'm really excited. September is just a really exciting month for me in what I do and what drives me, because September 24th is World Contraception Day. So it becomes a really big day for us. But this is an example of how, if we take some passion to what we do, and just in 5 years, we can see some of those trends being picked up in numbers, which is huge. And what I see is a lot of empowered women in Alberta,
And so
who.
where would you like us to be next September 24th in Alberta in terms of uptake of long-acting birth control?
I mean, I think uptake is really up to women. So I certainly, I always say my goal isn't for you to pick any particular method. Whatever method you choose at the end of the day is going to be the best one for you, right? My goal is to make sure you have the right information to make those decisions, right? So you're not making that information or those decisions on lack of information or perhaps misinformation. And so a year from now, I did start Project Empower Her, which is a non-for-profit, which is focusing on empowering women, especially vulnerable girls, by improving awareness and access to long-acting forms of contraception. And so some of my key projects I would like to see is some sort of patient videos that we could get set up to help improve just awareness. A really good, solid Canadian, there's some really great US sites, but they have slightly different sort of setup. So something that's a good Canadian resource for women to come to and just hear about some, getting good information about long-acting contraception. I also have to train healthcare providers, because again, not all of them are well versed in these things. So, I'd love to set up modules or some sort of continuing medical education for healthcare providers. And then I think that universal access. So, that universal coverage, because sometimes costs can be an issue, because, these methods of contraception can cost several $100s, which can be a lot for women who don't have those types of resources. And so something that would, sort of address the cost issues, I think would be key as well.
Right. And so, I've been reflecting on your comment that long-acting birth control is a matter of public health. And you also said that, when women can control when they have children, that they can do other things in advance, and they can, sort of be the best person they can be. And, Abraham Maslow used the term self-actualization. But for him, that wasn't the highest point. He, in his later writing, he went on to talk about how people having achieved that, which is sort of the vindication of the ego, that they go on to want to engage in activity that is selfless, that is devoted, that is focused on the community. Do you see long-acting birth control allowing women to contribute beyond beyond just getting themselves to, for example, reaching their educational goals, to focusing on the community in the way that you were doing in your career and you're doing right now for our benefit?
Yeah, so I'm a big believer that women are one of the most untapped and celebrated or, unused natural resources, right? Because if, why is it important for women to be living these, big lives and to be it's because, if we look after the people in the community that look after others, right? So if we support women, and women are biologically and socially wired to look after others, everybody does well, right? So we certainly know that, let's say, for example, contraception can open up doors for women for education. A lot of the number one reasons women don't get educated, especially in developing countries or even in developed countries in urban ghettos, is because of teen pregnancies. So teen pregnancies or child marriages, right? And so, the birth control, or sort of the reproductive cycle, begins very early, and that impacts her. And so that saying that says, educate a boy and you will educate an individual, educate a girl and you will educate the next generation, right? So there's really good data to show that educated women are more likely to have educated children, right? And so if you look anywhere in society or across the world, where women are doing well, those societies are doing well, right? And if you look anywhere where societies are struggling, women are struggling, right? So we really do need to look at women as a untapped natural resource and do our best to support them in living their best lives, because by inspiration and by biology and design, they're going to inspire and help and support so many people, their families, their communities, their nations, to do that as well.
So given the benefits of the things that could be achieved by long-acting birth control being used by many women, why would anybody object to it?
Yeah, I mean, I don't know if people object to the actual contraception part, but I do feel like, and I almost have to correct people, because sometimes I feel like, where we might get our biggest dissension is that somehow these conversations are encouraging young girls to have sex, right? And so I really have to kind of, clarify that point to say that, birth control is actually not about sex. Birth control is about having a reproductive life plan. That's what birth control is about. Because we know that if women do not have access to birth control, they will have 10 to 15 pregnancies in their lifetime. Not all of them will, carry to term. Not all of those children will survive, but, on average, maybe 8 to 10 children. And if you're having that, you don't have time to do much else. And it's not by accident that feminist wave of the 1960s, started when it did. It's not so much that the social change drove things. It was the fact that the birth control pill came out in the early 1960s. So it was really about that science and innovation and technology that really allowed for that social change to happen, right? So when women were actually able to control their reproduction, that only then were they able to consider other things for their lives beyond just, having babies.
It's a social change in the form of the feminist revolution and control by women of their reproductive desires is not welcomed by everybody, as we've seen in the United States with the recent Dobbs versus Jackson Women's Health Organization. That decision has sparked a wave of limitation in various states on access to abortion. So we can see that women being in charge is not necessarily welcome by everybody.
Yeah, I feel like, men or some men are often threatened by women, right? And so one way to control women is through their reproduction, right? So I really feel like, it's very, very concerning what's happening in the US. Like, it breaks my heart what's happening, because it's not about, it's not about sex. It is about keeping people in poverty, right? Because if you don't give birth control, you don't allow access to it, a woman is destined to have this many pregnancies and she doesn't have the resources to support those children. It's about controlling. It's about controlling women. It's about controlling different parts of society and keeping them down, because we've somehow, some people who feel like they need to be up to keep, they have to keep everyone else down to be up, right? And so, yeah, I mean, I can't emphasize enough how concerning some of that stuff is happening south of the border, right? It's really affecting the most vulnerable women the most, because the women that have the resources will still have access, but it's the women who don't who will continue to plunge, and their families, into more and more poverty and despair. And that's not a good thing for any society.
And it's not a good thing for men, because when men have mothers who are well cared for and can devote themselves to 3 or 4 kids, at the, 1 to 4, whatever their desire is, and not 8 to 10, then the individual boy child has more attention, which is vital to his growth. So as we conclude our conversation, I'm wondering what you would like this unusual group, which is caring and socially aware and concerned. What would you like us to do that might help you in your important work?
Yeah, I mean, just to be here today is fantastic. I think just start to have those conversations with your loved ones. Start asking about those reproductive goals. If you have any young boys and girls in your family, start asking them, when do you want to be pregnant? How important? Well, you should be thinking about some long-acting form of birth control, or at least educating yourself around it. I did do a TEDx talk about how long-acting birth control can empower women and change the world. So I would encourage everyone to view that and share that, just to get that.
We can find that on YouTube.
Yes, yeah,
Good.
TEDx Calgary, yeah, with my name on it, it should pop up. And I think, advocate if you can, if you have any political connections, about just start planting that idea of universal coverage for birth control, women 25 and under. I think that would be like, I think as Canada, I love this country. I feel like we are super progressive. We are small enough and developed enough to really be a global leader on some of these things. And if we can sort of really push that agenda for having that, universal coverage for contraception, women 25 and under, I think that will really make our mark. And check out our website, projectempowerher.ca. We slowed down during the pandemic, but we're hoping to maybe pick up some projects and stuff. So, come visit us there and, share that with family and friends. And I think it's just, let's start to get this buzz going. Let's start to get a little bit of this conversation. Let's start to really, respect and give birth control, the celebrated place in society that it really deserves. And let's make sure that women always have, good access, education, and access to these procedures so that they can live these big and gorgeous lives.
Absolutely. Or ditto, as my husband often says when I say, I love you, dear. Ditto. Fabulous discussion. Thank you very much. There is so much more, of course, that we could talk about and have questions about. But I just wanted to follow up on one aspect, and that is that there is no abortion law in Canada. It's simply another healthcare procedure or program. The discussion has been absolutely thrilling this morning. Thank you very much. Well, dear friends in the audience, it's now time for us to say thank you to these 2 outstanding women. And we're at a tea party, and tea parties, as you know, started because women wanted to have the right to vote and seek elected office. And when they had meetings saying, please come and let's talk about these issues, unfortunately, the opponents would show up and they would disrupt what was going on. And so the women started having pink teas. And this is what we're using our pink teas for, to discuss issues and to bring women together. So first of all, let's pay tribute to Dr. Toor for her dedication of her professional life to improving the lives of women and children and boys and men as well. These are fundamental decisions. These are monumental decisions about reproductive rights, something that changes the course of life for our women. And they are endorsed by Dr. Toor's proposal is endorsed by the Canadian Medical Association, by the Association of Canadian Gynecologists and Obstetricians, and also by pediatricians. So it's coming together, and with a leader like you, Dr. Toor, I'm sure in a couple of years this will be possible. And so to say thanks, we do a toast. So I hope you will raise your cup or your mug or your whatever, and say to Dr. Toor, with great appreciation for your professional leadership, thank you very, very much.
Dr. Toor.
To Dr. Toor.
To Dr. Toor.
Thank you so much.
I love how you have changed the discussion and about health to really focus on and ask the question, what are your plans for your reproductive health? Stunning. And as a result, it empowers all kinds of other choices too. And how lucky we were that Dr. Juliet Guichon, an accomplished academic and an author of 2 books, has agreed to be our virtual Pink Tea host today. I was fascinated to see how you listened to Dr. Toor's answers to your questions, which were superb. And then you capsulized the important point and then moved the discussion forward. So to Dr. Juliet Guichon, let's say thank you very, very much to
Thank you.
Dr. Juliet Guichon. And I would say, the lucky students that have you for a teacher and the
you.
lucky patients that have Dr. Toor
Absolutely.
for their doctors. So I'm now going to ask for Doctors Juliet Guichon and Rupinder Toor just to turn off their video, perhaps mute for a moment while I bring you Famous 5 News. But remember, they're going to be back in just a few minutes for the Après Pink Tea. And you should have received either in your inbox or will show up in the chat room the link to get to the virtual Pink Tea, Après virtual Pink Tea. And that will be hosted by our wonderful chair of the Famous 5 Foundation, Preeta Galar. So there's so much more to continue talking about. So in terms of news, well, first of all, congratulations to the Canadian women's hockey team. Once again, thanks to them, we are world champions. And thanks to Dr. Hetty Fry, the longest serving female MP in Canada, who is currently chairing the Standing Committee on Canadian Heritage that's looking into Hockey Canada. So changes are coming, really good changes are coming. Now, if you live in Calgary, I would like to invite you to come to an actual Pink Tea, an in-person Pink Tea in the Crystal Ballroom of the Palliser Hotel, one of the 3 places where the Famous 5 were all together at one time. So that's going to be on October 16th. It's a Sunday, and we'll be sending information out to you in a couple of days. And we look forward to everybody in the Calgary area coming together and celebrating the 93rd anniversary of the Persons case. Persons case was where women were defined, the word persons was always defined as including both women and men. And it enabled Canadian women to become senators. If you're living in Edmonton, please go visit the Famous 5 maquette. They're still on the 5th floor of the legislature, and they will be there until mid-October. And after that, they're going to Ontario. So if you live in Toronto, please come and visit the Famous 5 after October 19th. October 18th is our special day, but will be open to the public on October 19th. And that's at Queen's Park in Toronto. Our next virtual Pink Tea will be around the question of women politicians at the provincial level. What's the power that they have to improve the lives of women and children? Well, today, of course, we heard, although the federal government funds healthcare, they do not deliver it. It's delivered at the provincial level. So what are our female MLAs, MPPs, MNAs, MHAs looking forward to achieving to make improvements to the lives of women and girls? So that will be a fascinating virtual Pink Tea happening on October 7th. And now, before we do our toast, as you know, at the end, we always do a toast to each one of us because we are leaders too. I wonder if we might have a special toast to Elizabeth the Great in gratitude for your 70 years as the Queen of the British Empire, Queen of the Commonwealth, Queen of Canada. To Elizabeth, thank you very much, Elizabeth, for all you have done. And may I say, I'm really interested to get to meet and see the important role that the Queen Consort, Camilla, will be playing in the next few years. So now, a toast to each and every one of us, because we are leaders too. And as I mentioned earlier, hopefully some of you are starting to think about your role either in the political sphere or the corporate sphere or the community sphere in your families to ensure that women are respected, that women's issues are dealt with. And so let's put our shoulders back and take a deep breath and say with conviction, yes, to me, I'm a leader too. So your teacup, let's say together, to me, I'm a leader too. Sorry, let's try this again. 5, 4, 3, 2, 1. To me, I'm a leader too. I want to say a special thanks to the questions from the 2 girls from West Island College. It's my faux pas or inability as a technical person to have brought you the questions that they actually videotaped and posed, thanks to Juliet, to Dr. Pinder today. And of course, a final thank you to Enbridge and to Samantha Fox for her very fine introduction. So over to you, women of the world. Take up the leadership, make the changes that we want to see happen, and join us in just a moment for an après pink tea or on the next Famous 5 Friday, October the 7th. Thank you. Merci. Miigwech. Bye-bye.
Hey, hey, hey.